and welcome back to another episode of the Healthy and Happy podcast series. I have a special guest here today that I'm really excited to talk to. This is Dr. Elizabeth Federick, and she is a LPC, a licensed professional counselor in the Phoenix, Arizona area, and has lots of different hats that she wears, and really great experience. And so Liz, I'm really looking forward to visiting with you.
Thank you. I'm excited to be here. I'm honored that you guys invited me.
Well, good. Why don't you tell our listeners just a little bit about yourself and your story a little bit?
Sure, absolutely. So as you said, I'm a licensed professional counselor. I own a couple practices in the Phoenix area, group private practices, and I specialize in relationships. So relationships, attachment, trauma, and really the impact of our childhood on our attachment styles and then on our relationships into adulthood. And so that's what I've morphed into over time. When I first got into the field, I was specializing in working with children and adolescents, and I have a lot of passion for that area. And because of the correlation between, I really wanted to work with that population because of breaking the cycle, right? And that's getting in when they're young, and but then recognizing that really that parental influence has to be addressed in order to effectively break the cycle. And so that's how I transitioned to that population. So that's, I see clients full time, and then I also host a mental health podcast. I'm a professor for Grand Canyon University. So yes, I stay busy indeed.
That's cool. How did you decide to become a therapist?
Well, so going back to the population that I chose to work with, in my early 20s, I was doing retail management. And so I worked with a lot of teens and young adults. And so the stories that they kept bringing to me, noticing themes in this, noticing a lot of relational themes, really. And so, I would talk with them, but obviously I am managing the retail store. I'm not a mental health professional at that point, but because of that, it just really drew me into that. And my passion for it just evolved over time. And so then I got my undergrad, went and got my master's in professional counseling, and then went on for my doctorate in psychology.
Super cool. Super cool. And how, that's probably, there are some of our followers and some of our listeners are interested in pursuing careers in mental health.
Yeah.
So I was going to ask you how you chose the particular degree paths that you chose, because it's very different if you get a degree in social work than psychology, than marriage and family therapy.
For sure.
We could have a whole conversation on that, though. So I was like, I don't want to get into that.
Well, for me personally, I knew I wanted to do counseling. So I know a lot of my friends, a lot of the providers we have in our practice chose social work because they wanted to have the ability to do multiple things. Exactly. But I knew very specifically what I wanted to do, and that's where I chose that discipline.
That's really cool. We have a fair amount of overlap. I was a marriage family therapist for over 20 years. And my master's degree is in marriage family therapy, and then my doctorate is in human development and family science.
Oh, okay.
From Ohio State, and one of my almost everything that I do in my work is influenced by attachment theory. One of my major professors when I was working on my doctorate was Dr. Ellen Hawk, who is retired now, but she was had done a lot of really good work on attachment and was a pretty good voice in that area. Of course, this was 100 years ago. So actually, I was just thinking about it the other day. I finished my doctorate 20 years ago this year.
Oh my gosh, that's how the time goes by. That is, crazy. It really is.
Yeah, I was 29 when I graduated, but it's just crazy that it's been 20 years. But so I love attachment theory. I think it's so important and influences so many of the things that happen in our lives. One of the things that I talk a lot about is that I think there are two main filters that influence everything that we do in life, and that is your personality, and the second one is your attachment style, and everything that comes at us gets filtered through those, and then that of course influences the way that we interpret them and the way we react to them. So people that listen to our program regularly know some about attachment theory and attachment styles, and at least how passionate I am about it. But why don't you talk a little bit about attachment and your work that you do there, and I don't know, maybe attachment theory a little bit if you want to, or wherever you want to go with that.
Sure. So I will warn you, I will start rambling a lot with this. So I will try to take a breath to let you intervene at some point. But
all right, I'll go right with you. I love it.
So with attachment theory, the way that I pull it into the work that I do is I start by really helping my clients to understand what attachment style that they identify with, but even beyond that, where that attachment style developed from. And so early on in my sessions, usually session 2 and 3, I'm doing a timeline activity with my clients where we are really breaking down significant events with caregivers, with peers, authority figures, and trying to get an understanding of what are some of the patterns and what were some of the repeated experiences that likely contributed to this attachment style. But furthermore, I talk about like the adaptive child and how we develop in childhood these adaptive traits, these adaptive behaviors in order to survive that environment. And so a lot of that then gets tied in with our attachment style. So for example, with an anxiously attached individual, they probably did a lot of people pleasing. They did a lot of trying to be really close to mom and dad at all times, the separation anxiety. And then we see that translated onto their partner. As with an avoidant individual, maybe they spent a lot of time isolated, a lot of time in their bedroom with friends. When things got uncomfortable, they would remove themselves from the situation. And again, we see this in adult relationships as well. And then with the disorganized, and we know that's the combination between the push and pull of the anxious and the avoidant, which, yes, based on your face, the struggle is real with the disorganized for sure. And it's really hard. The disorganized can be so difficult because the individual with that attachment style often doesn't know what they need. They don't know how to regulate their body, how to feel safe. But then that makes it even harder on their partner because their partner is just trying to show up and a healthy partner, just trying to show up, just trying to meet those needs, and also just as confused. And so that's when I use that work, we figure out, we do the timeline, where did these behaviors come from, and how are they showing up for you currently?
Yeah, that's really good. And it is, that disorganized attachment style is such a difficult place to live internally, and such a difficult place to interact with. And so for our listeners, so attachment style is essentially a rule book. The 80% of the brain gets wired by age 3, and 90% of the brain gets wired by age 5. And during the research shows that during the first 12 months of life, the blueprint for attachment style and attachment in our lives gets kind of laid out during those first 12 months. And then by age 3, attachment style is pretty well wired into us. And for most of us, for better or worse, we continue on with that attachment style from there forward. And Liz did a really great job of identifying that it's not just happenstance, it's not accidental. The literal way that our brains get wired is this co-creative process that occurs between an infant and his or her caregivers, primary attachment figures. And so Liz, what do you see? What kind of parenting leads to an anxious attachment style?
Yeah, and that's a great question. And then what I break down for my clients a lot, that these interactions, as you're describing with our primary caregivers, really sets that stage. And I talk about the importance of recognizing it's those consistent interactions, because it's so important that with the parents that I work with, we're all going to mess up. We're all flawed individuals raising children. And so we're imperfect, and we're going to raise an imperfect child. And so because of that, like, there are going to be times when we don't show up in the way that our child exactly needs, but it comes down to those consistent interactions with our caregivers. And so when we're thinking in terms of the anxious child, and it can go twofold, right? With whether the anxious or the avoidant, how those parents show up. So this can be the parent that is the helicopter parent that is overly involved. Yes, exactly. Just overly anxious about everything, really intrusive. It can also be the parent that is more removed, where the child is constantly trying to seek to get that attention, trying to get that connection. And so either way, but then either parenting style also has the ability to create that avoidant, where an overly intrusive parent may cause the child, their survival becomes, I'm going to pull away, this is too overwhelming. Or, if they are not present, then the child learns, well, I don't really need anyone, I'm fine. And so it's the adaptive traits that child picks up, but that comes from that insecure attachment from the parent.
Yeah, really, really well spoken. And I think part of what helps understand that too is, one of the first and imperative sort of jobs that the human brain has to figure out in this life is, what is the most likely way for me to be able to obtain and maintain access to and sensitivity from my caregivers? Because as human beings, we literally die without care. A human infant has to have a caregiver in order to live. And so that strategy, I think, really develops, and the research shows this too, it really develops from that kind of methodology. What's the most likely? And so, like you said, if you could have a helicopter parent that's overly involved, and that could lead to, if the kid's like, okay, what's the most likely way for me to succeed here in terms of being able to obtain access to my parent and to be able to maintain a sensitive response from him or her. The determination could be, well, the most likely way is for me to just lie low, to not create any waves, not to rock the boat, or if things are so hectic with the helicopter parent, it might be, the safest place for me to be is back a little bit. And so then the avoidance strategy gets developed, where it's like, relationships can't really be trusted to be too close, and so I need to create some space here. Or it can be, this is so unpredictable in terms of what kind of responses I'm getting, that I need to be really, really pendiente. Sometimes
hypervigilant with it.
Yeah.
Yes.
Hypervigilant how to do that. So it's
and exactly what you're describing, and that's such a critical way to put it, that obtaining and maintaining, and I would even take it a step further and say safety. And so yes, the connection is important, but even more, our brains are desired to seek the safety. And so that is where, when we talk about the disorganized attachment, that's where really it becomes devastating, because that child is wanting connection and they're wanting safety. And generally the parent that comes along with this is abusive, volatile, chaotic, or, as you're describing, inconsistent. And so that child does not know what they're going to receive from day to day. And therein lies that disorganized response. Yeah,
really well. So again, for the listeners here, so the strategy, a securely attached child, the secure attachment style rule book, that's one of the, I really like that kind of methodology, because it's like, when the attachment system gets turned on, then these rules go into play of, this is how I go about trying to get my needs met, right? And the secure rule book trusts relationships, says that it's safe to seek, to vulnerably turn toward and seek out the attachment figure. They expect a sensitive response. And so that they have a consolidated rule book that says, when in need, and when that system gets turned on, what you do is you seek out help and you trust help. And the avoidant rule book says just the opposite. Relationships cannot be trusted. I don't have confidence that I'm going to matter to the people that I should matter to. And so the rule book says, when that gets activated, what you do is you try to not depend on anybody. Go inside, turn to somebody else, distract, do anything other than be vulnerable. And with an anxious rule book, and then even exacerbated in the disorganized rule book, there's a lack of consolidated expectation or rules. And so the anxious rule book says, okay, when that gets activated, you've got to be on the lookout for any sign of danger and be looking for constant reassurance that you're there, that you're still there. So they'll text, 20 times in 15 minutes, and they'll make lots and lots of phone calls to make sure that access, that tether isn't severed in any way. And then the disorganized rulebook is lacking any rules. They just don't know. There's not a consolidated framework of this is how you go about getting your needs met.
Yes. And I would say, as somebody who shows up as disorganized when triggered, that the rule book is whatever I can do to be safe, whatever I can do to make it stop, right? And so that is often, and with disorganized attachment styles that I work with, that's often what is talked about. Is the rule book really boils down to whatever has to be done to feel safe. And that inconsistency of sometimes it's seeking and sometimes it's pushing away. And their poor partner is like, what's it going to be today? Because the child was asking the same question. What's it going to be today?
Exactly. Yeah. And I think you also mentioned another thing that I think is really important, which is kind of that balance between understanding where our parents or caregivers were coming from and having compassion on the fact that they were doing their best. And then also not excusing unhealthy behavior and continuing to take responsibility for having your needs not met.
Yes.
If that makes sense.
It absolutely does. And I think we're seeing that trend shift a little bit. A good friend of mine on Instagram today, she even posted at Alexa Bailey that about that discrepancy that we keep running into of telling people that their parents did the best they could. Like, they did the best they could, let it go. They didn't know any better. They had their own trauma, their own experiences. And she touches on how that is completely invalidating and completely just not an okay excuse for that child not getting their needs met. And so I've seen that pendulum, and I'm sure you being in the field for as long as you have as well, I've seen that swing to, we were giving a lot of validation to, they did the best they could, and trying to look at it from that, trying to reframe it for the child, to present day of, okay, maybe they did the best they could, maybe they didn't. And it wasn't enough. It didn't meet the need. It didn't provide safety. And that "and" is what's most crucial. Regardless of your intention, your child has been impacted because of your poor parenting skills.
Right. And there's such a difference between an "and" there and a "but" there, right?
Yeah, absolutely.
And I think that's where a lot of people get stuck in trauma is, they're kind of shackled by the effects, harmful effects of attachment trauma repeatedly. And they can't quite allow themselves to be able to say, I should have had better. I should have mattered.
Yeah.
I should have been safe. I should have been able to feel safe. And I didn't. And I think it's really hard for the human brain to wrap itself around both of those things. We really want to go to either one end of the continuum or the other.
And unfortunately, both are dysfunction. So yes, and that is what we run into.
Yeah, neither works. another thing that you mentioned that I think is also super important to punctuate is that for those of you that are parenting right now, it's all about parenting, or it's all about pattern,
Yes.
right? No parent, no spouse, no partner is 100% sensitive and available during these attachment moments. We all screw it up to some degree. I have 5 kids, ranging from 25 to almost 8, and they've all experienced plenty of attachment trauma at the hands of their dad. And if anybody should know better, it should be me. I talk about this stuff all day long.
Yes.
But it's hard. Parenting's hard. And so the good news is that pattern is what matters. Do you want to elaborate on that at all?
Yeah, no, absolutely. And I'm so glad that you say that. And also there's a reason I had one, because you're absolutely right that, those were a lot of my fears going into it. And Diane Fulheller has, I don't know if you ever used her attachment quiz online. You can just go to the link and do the quiz. And what I love about her results is that it shoots out a pie chart. And so you can see the different percentage of how you're showing up, whether secure, the combination of all of them. But to your point, and I really appreciate you saying that, because I tell my clients that all the time. I'm a mental health professional and I specialize in attachment. And my son is not going to show up as secure all the time because of partly, what my unresolved trauma is and the way that I've parented him and all those things. But what I come back to all the time is it's how I show up to him after that rupture. And so if I didn't show up in the best way that he needed, whatever was going on for me that I couldn't provide for him in that moment, what he truly needed, I have enough awareness around that I can then go back to him, and I can go back and I can acknowledge where this went wrong and how it hurt him, what my ownership is in that, and how I'm going to do it better next time. And I think that that's the most important part when it comes to parenting. We have to know we're going to mess up, but just messing up and then excusing it as I'm just an imperfect human that's not enough. So we got to go back and repair.
Yeah. My 25-year-old daughter, who just started her second year of law school, came to this conference with me. I'm in Dallas right now at a conference for those of you that are listening, and my daughter Rachel came with me, and just, I don't know, a couple hours ago, she was saying that that's one of the things that she really, really appreciates, in particular in her mother, is that all growing up, my wife was very quick to apologize and to make repair attempts. And she said, I didn't realize that most parents don't do that until talking about things. And it makes a huge difference. I mean, we all make mistakes, and most of those mistakes can be remedied with good repair attempts.
Absolutely.
And a repair attempt is very different than an excuse, right? Like you said, just saying, oh, sorry, I did the best I could. That can be very patronizing and feel very dismissive, where it's, what, I'm really sorry. I didn't do that well, and I'm sorry the effect it had. And let's do a redo. What I should have said, or what I wish I would have said, or sometimes it's just, come here and let me give you a hug, right? But it's validating and safety, the word that you keep using, is I think the perfect attachment word, right? I made it so that you didn't feel safe with me, and I want you to feel safe with me. I want you to feel seen. I want you to feel soothed, and I want you to feel safe. Yeah. And so, come here and let me help you feel that way. That's
exactly. And that using that term validating is so important as well, especially in our repair attempts. That can be a confusing thing for people as well, that we can go to repair and we can validate the feelings of that person, of how we made them feel, that we created that pain. And that's part of the ownership process, that, yeah, I did that and I am so sorry. And as you're describing, either it's, let's redo this is what I wish I would have done, or furthermore, this is what I'm going to do in the future. And that makes all the difference. And your kids are incredibly lucky to have a mom who shows up for them in that way. And I'm sure father as well, but it sounds like mom's really.
she's what, and part of that has to do with personality. I think it's, yeah, I'm not quite as intense as my wife is, and so I think it's almost less of a big deal if I
if you rupture.
right, and it's yeah, it's also, yeah, less